Hello friends, this is your forensic med mentor and today we are back with a very special discussion as it is the 39th anniversary of the tragic Bhopal gas incident. On your screen you can see the poster of the trending Netflix series The Railwayman, which has wonderfully depicted that horrific night of December 2nd of 1984 where a group of railway workers saved thousands of lives. And below is the photograph taken by Pablo Bartholomew. Another photojournalist was there, his name was Raghu Rai. He also has taken a similar photo in black and white. Actually, they both came to Bhopal after knowing about such devastating incident. And when they were traveling across the street of Bhopal, they saw a group of people gathered around a father. That father actually was burying her child who has been poisoned to death by that gas leak. And they took several shots of it when the father was pouring the dirt on the grave. And when the father has completed filling up the grave, they could not go and ask the father his name or the name of that child, as they were completely devastated in sorrow. They stood still and cried. So this was the story behind that photograph, a famous photograph. This photograph actually won the Photo Press Photo of the Year in 1984. So that gas which was involved in this Bhopal gas tragedy was methyl isocyanate, MIC, the Bhopal gas. So today we are going to discuss about the physical properties of this gas. Where is this gas used actually? What is the mode of action or mode of toxicity of this gas and the usual fatal dose? Then what are the clinical features and how we can treat them? And what are the postmortem findings? We're discussing the postmortem findings which we got in the victims of the Bhopal gas tragedy. And finally, we will discuss how that night panned out of December 2. What happened? What is this Bhopal gas tragedy about? And a small discussion about a controversy about the gas, whether it was actually MIC or something else. So moving on to physical properties first. In physical properties, it is MIC is actually a colorless liquid. MIC is a colorless liquid with a sharp odor. A sharp smell is there. And this liquid become gas. It become gaseous at 39 degree Celsius. Secondly, this is extremely reactive. This is extremely reactive and a careful storage has to be done. It is known to cause exothermic reaction. Exothermic reaction on contact with water. And there will be evolution of isocyanate vapors when this MIC comes in contact with water. Nextly, we move on to its uses. On your screen, you can see 7. 7 is actually a very famous bug killer in insecticide. The active ingredient, the main active ingredient or constituent of it is carbaryl, a carbamate pesticide, carbaryl. And to make this carbaryl, MIC is used as an intermediate. So, coming to the uses, manufacturing of MIC, first it is used in manufacturing of carbaryl. Carbaryl is a carbamate pesticide. Second use of it, second use is polyurethane. Manufacturing polyurethane, a plastic material. This polyurethane is used for making plastics, adhesives for rubber, and foams, that urethane foams you get. So this is about the uses of MIC. Coming to the mode of action, how it causes the toxic effects. Actually, there are two mechanisms. It has two mechanisms. First is it causes irritation. It causes irritation. Irritation of the mucous membrane, eyes, and respiratory tract. Secondly, it causes sensitization and induce immunological response. Induce immunological response. And that immunological response particularly causes bronchospasm. Now we will look into its immunological response. Actually, the exact mechanism of this immunological response is uncertain. Exact mechanism is uncertain. But it is told that acute exposure is associated with type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction. And it leads to early asthmatic response. So this is about the acute exposure. Next is what happens if there is a high concentration exposure or repeated exposure of MIC. So when it is a high concentration or repeated exposure is happening, then it is told it causes delayed IgG mediated hypersensitivity reaction. And this delayed IgG mediated hypersensitivity reaction is associated with airway inflammation. And this airway inflammation may persist for months or years. Next, coming to its usual fatal dose. At 2 ppm concentration in air, the odor or smell may not be recognized, but in the victims there may be irritation and lacrimation symptoms which may be noted. So we are not getting smell, but symptoms have started to appear. Symptoms of irritation, lacrimation, they may be noted. Then at 4 ppm, these symptoms become more marked. Symptoms are more marked. Then at 21 ppm, when the concentration in air reaches 21 ppm, it becomes unbearable for the individual. It becomes unbearable for the individual. So this is about the fatal dose. Coming to its clinical features. As I told, it will cause irritant feature. So firstly about ocular features. In ocular features, first is lacrimation. Next is photophobia. Third is swelling of the eyelids, lid swelling. Fourth is corneal ulceration. This ocular exposure can also cause permanent damage to eye. In eyelids, we see a syndrome. known as Bhopal eye syndrome. So what we get in Bhopal eye syndrome, in eyelids there is trachoma formation, then there is lid infection, then there is irritant symptoms. These together constitute the Bhopal eye syndrome. Actually, there was a study, follow-up study after the 3 years of the incident, where they found that the survivors of the Bhopal gas tragedy has cataract formation, increased lid infection, and decreased visual activity and irritant symptoms when compared to the controls or healthy individual. Then coming to the respiratory features. In respiratory features, there may be cough, choking sensation, there may be respiratory discomfort, dyspnea, patient may be complaining of chest pain, there may be hemoptysis, patient may be coughing up blood, then there may be pink frothy discharge from the nostrils, and there may be pulmonary edema. So these are the main respiratory features. Actually, in respiratory, a single exposure will cause sensitization, as we have seen in the mechanism, as we have discussed mechanism. So a subsequent exposure, a re-exposure, will cause delayed severe asthma-like attack. Asthma-like attack. And this airway response actually in MIC poisoning can be of two types. Airway response may be of two types. First is immediate, another is late. In immediate response, it will be the onset of symptoms within 30 minutes. In late, the symptom onset will be after 1 hour or more. So there may be immediate response or late response or both in an individual. What are the other features? In skin, the dermal exposure to MIC may cause erythema and vesiculations. Some less common features are, less commonly we may see vomiting, convulsions, coma. So these are less common. Coming to long-term effect of MIC. First and foremost, it's RADS. What is RADS? RADS is reactive airways dysfunction syndrome, airways dysfunction syndrome. So there will be actually a sudden onset asthma-like attack when there is high level exposure to this corrosive gases or vapors. Next long-term effect is pregnancy related. After this MIC exposure, there was multiple reports of spontaneous abortion in the victims of Bhopal Gas Tragedy. So there is high incidence of abortion, and is also found to have increased perinatal mortality. Increased perinatal mortality means there was found to be increased deaths of the fetus or infants. Fetus which are more than 28 weeks of gestation, and infants or the neonates within the first 7 days of life. Coming to the treatment part. First is decontamination. As it is an irritant, we have to decontaminate the skin and eyes by irrigating with saline. If a person is wearing contact lens, we have to remove the contact lens and irrigate for 15 minutes at least. Irrigate for 15 minutes. Next is using topical antibiotics if there is a secondary infection. For secondary infection. Then if there is severe iritis, then drug of choice is topical atropine or homatropine. If there is severe iritis, we can use topical atropine or homatropine. Next, if there is ingestion of MIC, what to do? In those cases, activated charcoal may be beneficial. Stomach wash is contraindicated. Stomach wash is contraindicated. Stomach wash is contraindicated. Instead of giving stomach wash, we can give a glass of water or milk. It has shown to give a symptomatic relief to the patient. So we may give a glass of water or milk to the patient for symptomatic relief, provided the airway is protected. Okay, airway should be protected before that. Next, in cases of inhalation, first and foremost thing is to minimize the toxicity, we have to cover the face with wet cloth. It has shown to minimize toxicity. Okay, and then we have to remove the individual from the environment, the toxic environment. Removal from toxic environment. And then we have to admit the patient and observe for 72 hours. Why 72 hours? To see for delayed lung injury. To see for delayed onset acute lung injury. So we have to admit the patient, observe for 72 hours. Coming to management of respiratory distress. There is a clear respiratory distress. What to do? First is giving oxygen, then endotracheal intubation and assisted ventilation. Using bronchodilators and corticosteroids have shown to be beneficial. Using bronchodilators and corticosteroids has found to be beneficial. So what to do in severe cases of respiratory distress? We can administer beta 2 adrenergic agonist. We can give inhaled ipratropium bromide, which is a anticholinergic, a short-acting muscarinic antagonist. It is used for severe respiratory distress. It acts as bronchodilator. Next is giving systemic corticosteroids. Prednisone at 1 to 2 mg per kg per day dose can be given of prednisone. Next, if there is acute lung injury or there is pulmonary edema, in those cases what to do? First and foremost, CPAP, continuous positive airway pressure. And severe cases of acute lung injury or pulmonary edema, we have to go ahead with intermittent positive pressure ventilation with positive end expiratory pressure. Next, coming to the postmortem findings. The findings which we got in Bhopal Gas Tragedy victims are cerebral edema. Next is cherry red color of blood. What is cherry red color? On the left of your screen is cherry red color. On the right is bright red color. So you should know how to differentiate between cherry red color and bright red color. Cherry red color of blood. Third, fatty infiltration of liver. And fourth, renal tubular necrosis. So when postmortem examination was conducted in the Bhopal Gas Tragedy victims, there were cerebral edema, cherry red color of the blood, fatty infiltration of the liver, and renal tubular necrosis were the main features. So generally, during the postmortem examination in case of MIC, we get signs of asphyxia. What are signs of asphyxia? Petechial hemorrhages, peripheral cyanosis, visceral congestion. Okay, then apart from this classic triad, we may get fluidity of blood. Okay, right heart engorgement. Then coming to secondly, we may get pulmonary and cerebral edema, and there will be a generalized visceral congestion. Next, coming to the Bhopal Gas Tragedy. So we will discuss what happened in that Bhopal Gas Tragedy incident. So on your screen you can see two images. On your left is a statue. This statue was actually dedicated to those who were killed and disabled in this Bhopal Gas Tragedy. This statue is showing the agony of a mother holding her child. On the right hand is the abandoned Union Carbide plant. The plant which was responsible for the leak of methyl isocyanate MIC, the gas which was involved in this catastrophic disaster which happened in Bhopal, Madhya Pradesh in 1984. It is regarded as the most dreadful industrial accident in the history, leaving officially more than 2,000 dead and more than 2 lakh people injured. But if unofficial figure goes, the estimate put more than 10,000 deaths happened due to this catastrophe. This incident actually happened in a small pesticide division of the Union Carbide, which was manufacturing carbaryl. As I told, carbaryl manufacturing needs MIC as intermediary. So this toxic chemical was stored in huge double-walled stainless steel tanks. One of these tanks got burst on the night of December 2nd, 1984. Because of this tank burst, what happened? More than 24,000 kg of MIC gas escaped over the next several hours on that night. A white cloud of MIC formed, which drifted over the populated surrounding neighborhood under that night sky, killing thousands who are either asleep and incapacitating several thousand more people. Many civil and criminal cases were filed against the Union Carbide company and Warren Anderson, who was the CEO of company at that time. Total compensation of 250 million US dollars was awarded because of this filed civil cases. In 2010, Government of India also approved a 200 million US dollar package for the victims. In June 2010, court convicted 7 people, including the chairman of the Union Carbide, for causing death by negligence and gave an punishment of imprisonment for 2 years and 1 lakh fine. There was also 8th convict, but he died before the judgment was passed. Next, coming to the controversy over the Bhopal gas. Some are telling it was not MIC completely. There was hydrogen cyanide also. And so this controversy came whether MIC was entirely responsible or HCN was also the culprit. Why this HCN suspicion rose? Why this was suspected that this gas was present? Because, as I told, cherry red color of blood was found in the victims. This cherry red color is typically associated with hydrogen cyanide poisoning. Next, what was found is increased thiocyanate levels in urine of some survivors. Then what was found is symptomatic relief after administration of sodium thiosulfate. Then there was also evidence that HCN was actually not the toxic component. In that, main evidence was no hydrogen cyanide residue was detected in and around the plant and also in the neighborhood places. And no cyanide was actually reported in the tissue samples of the victims sent for the viscera chemical analysis. And pattern of mortality actually was not consistent with cyanide. Cyanide is known to be an instant killer. It kills within seconds. But in these cases, there was some lag between the onset of symptoms, there was development of pulmonary edema also, and then death happened. This is not consistent with the pattern of cyanide poisoning. And one more thing is that hydrogen cyanide is very light. It is lighter than air. So it could not descend like MIC to the ground. Another thing which was talked about is the sodium thiosulfate effectiveness. Actually, this beneficial effect of sodium thiocyanate may be because of the environmental exposure of the cyanide, as many victims were the slum dwellers. So they were using fire. It was winter, December winter. So they were using fire in their home to keep warm, and also many of them were chronic smokers. So this beneficial effect of sodium thiosulfate may be due to that. And cherry red color of blood may be due to the formation of carboxyhemoglobin from exposure to the atmospheric carbon monoxide. So this explains the controversy that it was MIC only, which was the culprit gas. These are the references for my talk. Thank you.